Yes, Martin, and a very big budget it is too, more than £100 billion. Mr O'Brien, there has been increased investment in the last 12 years under this government. How well do you think that has delivered value for money?
Well, if you're a patient, you get your operation done not 18 months later, but typically now within about 8 weeks, maximum of 18 weeks. We've got about 80,000 more nurses, 40,000 more doctors. We've got an NHS which is delivering much more effectively than it ever has done. We found an NHS which was on its knees, under-resourced, understaffed and under-managed, and I think some people sometimes are very critical of management, but what we needed to see was a much more effectively managed NHS that delivered much more effectively for the patient. And I think we've moved very strongly in that direction, and patients are seeing the results because they're getting a better service.
But do you think people see it that way?
I think most people see that they get their operation done much more quickly than they did in the past, that we've dealt, for example, with some of the issues around hospital-acquired infections much more effectively, massive drop in hospital-acquired infections, certainly over the last 2 years, that there are more nurses, more doctors, and yes, that people get a better service. But there's always room for improvement, and with a massive organisation like the NHS, there are always things that need to be done better.
Now you talk about making things better, which leads us on to Darzi, because that's what Darzi was all about. How well do you think it's being implemented?
The NHS has gone through 3 phases. First of all, we had to deal with the underfunding. Then we had to reform the process so that we ensured that patients got more of what they wanted, and the NHS was much more patient-focused. And now we're shifting onto the Darzi agenda, which is essentially to improve the quality of what the NHS does. And what we know is if we improve quality, it costs less, it gives better service to the patient, and we ensure that we get a better delivery from the NHS as a whole. Will it be a success? Yes, it will, because it's got massive support and we've got to do it.
What about commissioners? How well are they helping to reduce health inequalities?
We've had to improve massively the quality of the way in which commissioning takes place. What we've done is we've decentralised much of the decision-making process, but we haven't always had the quality of experienced managers who are able to carry out that commissioning. That's why world-class commissioning is about spreading best practice throughout the health service, ensuring that primary care trusts are able to do the commissioning that they do, and also, most particularly, to ensure that they seriously engage the doctors, the GPs, in making clinical decisions about what is best for the NHS. So it's the bringing together of that clinical judgment together with good management that world-class commissioning is all about.
Finally, Minister, could I ask you, what would your message be to people attending the NHS Alliance Conference?
My message is that you're getting funding increases over the current 2-year period of 11%. Make sure that you get the benefits from that. Make sure that you do innovate. Make sure that you are spending that money well, because we need to ensure that we have a health service that delivers for patients. That's what you're in it for. That's why I'm here. And that's what this government wants to see. And we don't want to see large-scale cuts in the NHS. And we are very clear about that.
Mr. O'Brien, on that note, we will leave it. Thank you very much indeed for speaking to us. Martin.